All right. Well, we're going to get started with our Q&A panel. So if you have a question, don't be shy. These guys are super excited to get to talk to you and answer your questions. We want to keep them limited to just one question and try to keep it as short as possible because we want to fit in as many as possible before 5:55. So anybody have a question, come on up. Come on down. Or you want me to come to you? I don't mind doing that at all. I'd love to talk to you. I'm getting my steps in today. I'm excited. All right, here we go.
Hi. I had a question about... Oh, can you hear me? Oh, I hate it. I had a question about it. In traditional thought about why you don't want your LDL high, because the traditional thought is it's going to cause heart disease. What do they think? They say, well, it's going to cause plaque. How do they explain that as far as like, you see all these people with high LDL but not getting heart attacks? Are they expecting some magic to happen? I mean, I'm not explaining this well, but
yeah. So
what mechanism does traditional medicine think that LDL causes heart attacks?
So I'm going to be mesmerizing you here. The LDL causes heart disease. Didn't you see the little girl with the LDL of 700 and she had a heart attack by the age of 5? And so the world experts basically used that information to say LDL was causal. Really, that it was that girl. And Dave Feldman showed the case this morning. So then what so I'm going to be a medical establishment person, we did studies to lower LDL and people had fewer heart attacks. And then it's true, but they didn't not have any heart attacks, it was just fewer. And so if you take a medicine to lower an LDL, you can actually have fewer heart attacks. But it's not very powerful. So when you do an LDL, well, the LDL is normal in a lot of people who have heart attacks. Let's look at the small LDL. So the story has become, it's not just LDL, it's the large versus the small LDL. And it's those small LDLs, and I used to do NMR lipoprofiles. Have you ever had one of these done? And I'd be looking, and people would come in all eager-eyed, Doc, I want the NMR because I know my small LDL will be gone because I'm doing keto. And the small LDL wasn't all gone. Actually, so I'm now kind of in that camp of, we don't really know that LDL is the cause, but we've been taught that. And you just need to understand that LDL causes.
And the studies, when you look at the studies where it's that 33% reduction, it was a relative risk reduction, not an absolute. So they went, I don't remember the data, but they went from like 98 heart attacks to 94. Not deaths, but heart attacks. But they called it a 33%. There was they did magic with their statistics. It wasn't, they went from 100 to 70. They took that and it was a relative risk. It was a percent of a percent, but they did the reverse math. So, and half of the people that die of a heart attack die with a normal cholesterol, right? Something like that.
So someone just emailed me today. They said they saw the movie, have you seen these documentaries, Fat? A documentary and fat fiction. Yeah, so these are out there. You can watch these documentaries. Also, Serial Killers, Cereal, and Serial Killers 2. These are must-watches if you like to get information from videos. And so I'm quoted, I have a cameo in one of these fat documentaries as saying, they've never done a study showing that the fat in the food goes to the fat on the arteries. Which is true. You would think you'd radio-labeled fat in the food, and you could see the radiation in the artery. That study's never been done. So there's a lot of assumptions that. Anyway, so I don't even worry about blood cholesterol so much anymore. I go to the advanced testing, and if you haven't had the CIMT yet here, what a great opportunity. Yeah, it's $100, but so you got the machine right there, and you can know in 15 minutes if you have narrowing in the artery of your neck. Something that the monopoly of the medical system would keep away from you until recently. So I'm a big advocate of you getting your own information about your own arteries in our area, there's a company called Lifeline Screening that goes around. And this is even before you do a CT scan of the coronaries. That's fraught with other issues. But yeah, I think there's a lot more than the LDL. Don't get distracted by that.
We have someone else?
Yeah.
Okay.
Okay, there's been a lot of talk on internet about thyroid issues being caused by keto. So what I want to know is, because I've been on keto about 3 years now.
Stay closer.
Oh, I've been on keto about 3 years now, and I lost about 60 pounds. I still have more to go, but you know, I'm on my way. But I'm starting to have more symptoms of maybe Hashimoto's, and I've never had problems before, and I've had my thyroid tested before, and so when I went to my doctor recently to get on estradiol, she said, let's do a search when you come in for your annual to see if it's your thyroid or if it's just hormones that are off a little bit. Is there any basis or anything that shows that diet can bring on Hashimoto's or any of these things?
No, not that I'm aware of.
Okay.
So this is kind of like when Dr. Lenses came up and said, are these hives from keto? And we all kind of said, no, we've never seen that. So anything can happen even when you're doing any sort of diet. I don't know of any evidence that says that this way of eating causes hypothyroidism or Hashimoto's. And let's be clear, you don't even know if you have it yet.
No.
Yeah, right. So there's a worry about it.
What were the symptoms?
Yeah, I wasn't going to get into the diagnosing. So sorry, doc. No, but you know, I've had someone on a keto diet have a heart attack. Yeah, with pre-existing heart disease. You know, and I could have said, well, he wasn't following it all that well, but I didn't say that. I said, well, you know, so you know, people on keto, they have car accidents. So the more common things that people come to me with is, you know, I had a kidney stone, I had diverticulitis. Well, those happen on any diets. And so it is really needed to know if it's any more frequent on this kind of program, something like Hashimoto's even, is a comparative kind of study, ideally observational, and you randomize people. I don't know if that's going to happen to that degree. But so things can happen, and follow what your doctor says in terms of just checking things and responding. Don't follow a knee-jerk reaction of that's bad for you if they have no evidence for it. And that it sounds like you're still kind of just worried about it when just get the test and see. Any other thoughts about thyroid?
People have low thyroid, like you said, internationally, globally, overweight, underweight. It just sometimes happens. Anybody? No. We don't know enough.
Got another one?
So I had the fancy little calcium scan there, as did my wife. I, in fact, have some build-up blockage, whatever the build-up blockage. In addition to keto low carb, what sort of ideas might you suggest without diagnosing that I could use to reverse that, clean it out?
So you're talking about the coronary artery calcium scan? Oh, no,
No,
out here.
the
Oh, okay.
test out here.
The test here, that the $100 test here.
The CIMT.
So that's the carotid intimal media thickness.
That one.
CIMT.
Yeah, that one. I can't pronounce
So
all
you got to
that.
be careful because, you know, Dave, I wanted to make sure the difference between the CT angio and the coronary artery calcium is huge. So if you've gotten a coronary artery calcium score, it's very different than what the study is studying out in LA, looking at the CT angiography. But the CIMT looks at the artery here with ultrasound.
Yes, the one they do right here.
Yeah, and if you have disease, then you're going to want to take measures, which is to improve glucose metabolism, to not smoke, right? To work on these metabolic syndrome parameters, and probably exercise, you know, and maybe have some wine, yeah. Everyone likes that one. But you know, I have to say there are a lot of, manage stress, thinking of all the other talks today. All of these are really important, although that may play through blood pressure, the stress management, and may help with blood pressure. But in terms of diet, I think the keto diet lowers the inflammation and lowers the cardiometabolic risk, like many other diet programs. So, beware of the doctor who says, "Oh, you have to do a plant-based approach." There's no evidence for that. And there are no comparative studies of a keto diet with a plant-based for them to say it's better than anything else. They can't. I mean, it's just kind of a fad that's coming through the pop culture right now, including doctors. But, so you could do another scan of the aorta to see if you have it, an ultrasound, and then the CT scan of the heart basically shows you if you have calcium, which doesn't mean you have heart disease, but it is another sort of risk assessment that you could do. I don't normally recommend all these things unless someone's worried about it in my practice. If someone's coming to me, they feel well, they've lost weight, they're doing a keto diet, I don't ask them to go out to do these things, but many of them want to do it. And other ideas for someone who has known carotid narrowing.
Yep. Rigby?
One thing I would say is that's what it is right now. We don't know where it was, and we don't know where it's going. So
Correct.
part of it would be you have the results now, and maybe in a few years have it repeated and see if something's worsening. Because all we do is a snapshot. We don't know where it could have been there your whole life, and it could have been
The
developed
lady
in the
did
last.
say that it did not happen in a year or a couple of years. She said it's been there for a while. So
Exactly. So that's where following it, doing the things you're doing, because you probably haven't been doing this low carb keto for a long period of time. So it could have built up before that. Now it's maintained, maybe reversed. We don't know. So that's where following the trend for the next little while to see where you're going.
thank you.
Okay, does anybody have one final question? I think we have time for one final question. All right.
Two things, actually. Both are for Cindy. The first, regarding the normal cholesterol levels during heart attack, if you're talking about the study that I think you are, that's admission levels, so at the hospital when they're actively having the heart attack, I would want to be a little careful about that, because we do know that acute trauma, even like burns or sepsis or stuff like that, can lower LDL in the short term, just as a response, organ failure, all sorts of stuff. But the actual question that I had was regarding GERD. You had mentioned it during your talk, and I've also seen some papers using low carb to treat it and actually come off of medication for it. Do you have any ideas of what might be causing it and why low carb helps? Is it inflammation of the gastrointestinal
Yeah,
system?
I would be guessing. I'll refer to the two doctors here.
Well, we did a paper, a GI fellow at Carolina did a paper with NG probes, pH probes. So this is, if you have severe GERD or heartburn, this is, often it's acid, excessive acid. You take an antacid, it goes away, right? So we took people refractory GERD and put them on a low-carb diet, and within 3 days, the pH normalized, meaning there was less acidity. And this was documented by a tube down the nose, and there's a little box that says the pH on it. There was only a dozen people or so, so it's called a proof of concept sort of study. There have been other studies out looking at carb restriction, and it didn't have to be that low. There was one paper where they had about 80 to 100 grams of carbs per day, but no sugar. And so, so you might not have to be that low to get the improvement in heartburn. And then I remember in the discussion, it was at the early microbiome days. There was a brilliant discussion about how actually it could be the change in gut microbiome feeding back to not feed back to the gastroesophageal sphincter. And I was like, it can't be that. So, but buried in that paper, so it's Westman, Greg Austin is the first author on it, has actually a pretty good discussion that holds up today about the possible microbiome influence. And of course, I think the best way to change your microbiome is to stop eating carbs.
Very
Without-
cool.
You don't
Thank
have to, pardon?
Very cool, and thank you.
Oh, you're welcome. But so more research is needed. I thought by now we'd have NIH-funded gastroenterologists all over this. I mean, except they want to know the mechanism so then they can give a pill to fix the mechanism. So in your clinical experience, does GERD get better?
Now, I did say, oh, did you want to answer one more?
Yes, it does.
Now, I know we said that was the last question, but there was one question that came to our attention that I think is so important. We really cannot leave here on day one until we get an answer for that. Could you go ahead and ask that in question?
It's very pressing. I need to know your favorite cut of steak.
That's for each of you.
Ribeye?
Filet.
Ooh, anything from a cow.
Picanha.
Ooh!
I didn't understand what that meant.
A picanha is a cut of meat.
Cut of meat. Oh, the Brazilian cut of meat. So, filet with béarnaise sauce.
Ooh, wow.